Quickly reduce. Hello, I'm Julian Mobilian. I'm the managing editor of Drugstore News, and today I'm with Sri Narasimhan. He is the vice president of enterprise customer experience at CVS Health. Thank you so much for joining us.
Thanks, Julianne. I'm excited to be here.
Awesome. So let's get started. CVS recently authored a white paper on the importance of the consumer experience and outcomes. And CVS Health analyzed the internal data to see how consumer satisfaction, which is measured by Net Promoter Systems score or likelihood to recommend the company, influences health related outcomes. So, I guess my first question for you, kind of delving off of that, is how does the customer experience directly impact consumer health?
Yeah, I think there's a notion in that, healthcare is different than any other industry. And I think when you think about the experiences you have in healthcare, what you really want is trust. And I think that's the same as in any other company you interact with. And to me, when you look it up in the dictionary, what trust is reliability, consistency, and follow through. And that's really what people want in healthcare. They want those things. And I think that what you see is that healthcare makes it difficult to get a lot of those things. And when you look at some of the numbers that you hear from consumers, things like, 50% of folks don't take medication as prescribed by a doctor. 50% of folks think that the U.S. healthcare system is challenged. There's a lot of trust that needs to be built in the healthcare system. And I think that's really where experience comes in, because ultimately, if you deliver a great experience, you deliver on those things that I just mentioned, reliability, consistency, follow through, people start to trust your company, they start to trust healthcare more. And when I think about CVS Health and what in the paper we wrote, the mechanism we looked at is really the pharmacy experience. And when you deliver a great experience, you make it easy to engage in healthcare, easy to engage with the pharmacy, stay more adherent to your medication, stay out of long-term care, you stay out of the ER, you have fewer inpatient days. The cost is reduced for you, the
Sure.
cost is reduced for the company and society. I think that that generates this big societal, impact that's really positive. And I think when you break it down, really, they're asking for really simple things, right? They want to know, is it covered? What does it cost? When will I get it? And can I trust what you've told me? And I think that's what the experience does. It starts building answers to those questions in a consistent, reliable way. And that ends up with these wonderful patient outcomes that you see when people have those great experiences.
It
So
is true. It's so true. I feel like that number is surprisingly low with 50%. I just assumed it'd be higher. I mean, it's crazy. I mean, it just shows how much work that there's still left to do. Um, and I guess so moving on to the second question, how has CVS improved the customer experience in stores? Sort of building off what you discussed earlier, how are you guys sort of, you know, taking that information and improving that experience for the customer?
yeah, I think we've focused a lot on as I mentioned, consistency and follow through, medication being ready when we tell you it's going to be ready. So, even just in terms of basic workflow, it's not the sexiest thing. It's not something someone will see, but making sure that,
Sure.
hey, when you show up, it's going to be ready. We're going to have it. Helping people manage that, I think, is really important because, honestly, when a visit to the CVS is usually a stop along a very busy day.
Yeah.
So if we've made that more difficult and disrupted your day. You're gonna, there's a chance you abandon that medication, you don't take it, other things become more important to you. So we try to make that as seamless as possible. A few ways we've done that is we've focused a lot on some of our workflow elements. We are lucky in that we have a huge pharmacy network. So when you see a CVS, there's usually CVS is nearby, a couple miles up the road, in the next town. So if the CVS you're in is very busy and people are doing a lot of it, there's a lot that we have to do to get that medication to you in terms of back office work. We've created a network using the cloud to kind of make sure that we can actually share the burden. So if there's another pharmacy that's not busy, they can actually do some of those things and do some of that administrative stuff that lets you manage the patient in front of you. Because there's nothing worse than when you're in line and you're like, why is that person in the back just doing something? You don't know, right, as a patient.
Right. No, that's
What
so
they're doing,
true.
what they're trying to do is manage
Yeah.
all the workflow and process so that we can take that out, increasing engagement. The other thing we got feedback that people wanted to engage more with the pharmacists. These are clinicians. These are people that are really valuable to us and valuable to the patient. And again, we have them in the back filling and doing all those administrative tests. We did something called virtual verification, which allowed them to verify prescriptions, which is what they're regulatorily required to do from the front. So they can stand in front and they can be there and they can engage with patients and get to know them and build relationships. Because, like any other healthcare business, a pharmacy is not a fulfillment center. It's an
Right.
opportunity to build like a longitudinal relationship with the patient. So those are some of the things we've done.
Oh, I
And
love
hopefully
that.
patients are starting to experience it in terms of
Yeah. And
getting
plus too,
in.
a bit more FaceTime with them with because like you said, they are clinicians. And I do think people like with most health visits, which I consider pharmacists an umbrella of that, they want more FaceTime. They want more of that interaction. And it's like you said, they're a valuable resource. So I think that's really great. And so it's kind of building off of that, what technology has CVS introduced and how does it improve the customer experience?
Yeah, we have focused a lot on the intersection between digital and physical experiences. So I think what you'll see is that we've increased our investments in our app and making it easier to manage your prescription in your app. I think we want to meet people where they are. So if you're digitally engaged, we want to make sure that you have the best way to do that digitally. If you're more engaged on your, physical experiences in the call center, we'll make those
Sure.
experiences as positive as possible. So in the app, we've made it easier to manage your scripts, manage refills, understand timing of when you need things like prior authorizations. And we're continuing to improve that and give you more control over your healthcare. I think on some of the other things we're looking at is how do we utilize AI to better understand customer
Oh
experience.
yeah, it's the biggest topic
Everyone
right now.
everyone talks about it. A couple of things we're doing there. We're this is more on my end, like in terms of data science and understanding the customer experience. We're using AI to, mine things like call transcripts. So we don't even have to ask you if you've had a bad experience. We know because we can tell from those transcripts, like,
Oh
the
wow.
way you were talking to our agents, you were really frustrated. We also are sitting on mountains of data that we can use to understand the experience. So if I knew Julianne came in and we missed the promise time or a prescription was out of stock, I know all that. So I know that she probably wasn't happy.
That's
So what can we do
interesting that you did
proactively to
all
reach
that.
out and fill that and make sure that she's okay, that she's getting her scripts. So really kind of using that data to be more predictive and understanding of the experience so we don't have to ask and we're not always
Right.
waiting for you to tell us.
You can just see and it's right there. That's really cool that you have that.
Yeah. That's like I
Awesome.
think that's a big focus area for us because I think traditionally, and I work in the customer experience space, you wait for someone to tell you they're frustrated, then you pick up the phone and you call them,
Yeah.
which is great. And I think you should continue to do that. And we still do that at CVS Health. But I think the more that we can, if we're talking about personalization,
Mm,
or we know that your experience was poor without you telling us, and then we just went and did it and we fixed it and we
yeah.
made it better, the more you're going to have faith in us as an organization. And going back to the comments around trust, the more you're going to trust us. Because nothing
100%.
feels worse than you get a survey after you've been on hold for 20 minutes, your script's out of stock, and no one's helped you. And
Right.
like, and we're like, hey, how was that experience? I mean, you're going to tell us it was miserable, but you should know it was miserable. You're the one who put me.
Right, exactly. I mean, I think it's cool because you guys are able to be more proactive in that space. And I think it will go a long way with customers because it's kind of like you said, it's a stop in their busy day. And a lot of people have these frustrations. And I remember what you said about prior authorization as well, which can be such a huge barrier or delay with a lot of things. So I think that's really cool that you're able to sort of pick up on this before like you can pinpoint it beforehand and correct it like kind of in real time, which is cool. I love that. And then I guess sort of to just tie it all together, what will the future of health and wellness look like at CVS Health? Kind of, we've talked about a lot of things, but tying it all together, what does that look like?
Yeah, I think if you think about CVS and what we want, I mean, we want to create a world where people are able to engage directly in their own health. I think that, up from David Joyner, our CEO, down, that's our focus area. Personalization, making health personal to you, because nothing's more personal in healthcare. The stakes are never higher than when
Yeah,
you're managing your healthcare. Give you more control over that experience, more control over your own healthcare, and therefore increase your engagement with your own health. Because going back to some of the comments we were having earlier, like poor experiences, difficulty managing the system creates disengagement, and creating disengagement makes people unhealthy.
Yeah,
And
it's true.
that's where you see costs in the system go up and outcomes go really south.
Yeah,
So the more we can create a world where you're able to engage more in your health and have more control of your health is what we're doing. And then the other thing, I think you said it. How do we become more proactive and less reactive? And again, we've entered a world now, just talking a little bit bigger picture, where there's never been more information about consumer experience. There's never been more information about what's happened to someone in your company.
yeah,
We have to leverage that and we have to use that to proactively get ahead of these issues and solve things, not just from a root cause perspective, but even in real time with patients. I think that's what we're pushing towards. Stop living in a world where we have to wait for someone to complain or wait for someone to tell us that something went wrong. We know, let's fix it.
it's
And I think the
true.
more we do that, the more we're going to build trust and deliver better experiences.
Yeah, absolutely. And I think even going further to help probably a lot of people with adherence, because I do think cost, time, those are big barriers. And I think that's really great that, you guys are taking those steps to help improve that process. I think that's awesome. Um, and I think those were all the questions I had. Was there anything else that you wanted to bring up that I did not mention or ask?
No, I mean, I think that was great, and I appreciate the time. And I'd just end by saying, I think that healthcare for us, it's not just a challenge for our company, it's a challenge for the entire country. And I think we
Yeah,
really want to be part of the solution as a company. And that's what we're really focused on. We're really focused on trying to make sure people have the best possible experience with their healthcare, because ultimately it keeps them healthier, it keeps them happier, and I think we all benefit when that happens.
it's so true. Thank you so much for the time. I so appreciate it.
Thank you. Thanks. It was great talking with you, Jillian.
Of course.